Good morning, everybody. My name is Raj Koduri. This is my first video. Actually, I'm not doing it in an operating room setting or ICU setting. I'm an anesthesiologist. I work for Saha, which is based in Abu Dhabi. We've been given a lot of personal protection equipment for the COVID-19. Thanks to the authorities for that. But as a practicing anesthesiologist, I see a lot of guidelines there. The Anesthesia Patient Safety Foundation, the American Society, the European Society, and of course, you got the local guidelines also. But at the end of the day, do we all read these guidelines and get them into our heart? And do we actually practice them in scenarios where your action is more reflexive than it is supposed to be in a COVID-19 situation? Well, this short video, I will not practically demonstrate anything, but then I will discuss small little tips to make your life easy and safe. As you all know, the coronavirus is now also aerosol-borne infection, and we are all using many techniques to practice safety in our operation theater, both for ourselves and our colleagues and our staff who are helping the anesthesiologist in the intensive care unit. Um, what I have seen over the last few years, and I'm sure many of you will recall the same, is that when you give the calculated, and when you start the process of anesthesia and you get your the oxygen mask on the patient, you actually put a general mask like this onto the patient. It will not be easy to breathe on this mask. So what I suggest is just get a little head up, the patient in the head up position, and then put your oxygenating mask on the patient face a little far away so that he doesn't actually push you and cause sudden movements which upsets everybody around the patient on the operating table. I will, Most of the anesthesiologists calculate the drugs based on their experience. So if you have a 10 kilo patient, you would like to give about 2 mics per kilogram fentanyl for this patient. And but what you will have noticed is that when you give the fentanyl, the calculated dose of fentanyl, the patient usually coughs, and a cough can release a lot of aerosol into the air, and it may spread wide around the mask, and we may actually inhale it and put ourselves into the risk. So what I am doing practically nowadays for the COVID-19 situation is that I calculate all the doses, but I start off with 1/3 the dose of fentanyl, which means that if I'm looking into a 70 kilo patient and the calculated dose is about 210 for induction, 210 micrograms, I actually give around 50 to 60 mics only, and that a little slowly, so that the patient doesn't buck and cough. Then I also ensure that the patient is not a case of difficult airway, and in that scenario, I will give the relaxant first rather than the induction agent. Because what I've noticed is when you push in the propofol, you have a lot of hypotension, and then you're diverted from the main issue, which is the COVID-19 and the aerosol-borne infection. And at this time, you may actually bag the patient vigorously, and then somebody will be treating the hypotension, one of your colleagues or your technicians, and then this sputum and this saliva around the mouth, and then you can spill it into the atmosphere around you. So what I do is I give the relaxant first, but I'm sure that this is not a expected difficult airway. Then I give the full calculated dose of the propofol for this patient, and then I give the balance of the calculated fentanyl for the patient. Now, for the last 10 days, I'm mostly using a south-facing tube, which is the RAE tube, the RAE tube, so that just in case the patient coughs and bucks because he's not fully relaxed, okay, at the time of intubation, about 30% of the time that can happen to everybody, you pass the tube passes the vocal cord, and that's when the patient just he does that. But if you have a regular endotracheal tube, you will find that this one, the aerosol from the trachea of the patient is directed towards you. But when you have the ray tube, it's south facing, and therefore is directed away from you. These are the small little tips which I find very useful. And this is only the part 1 of this video. I will post the part 2, the extubation criteria and the ways to extubate, and the safety precautions that help you and make your life easy and your colleagues safe and healthy around you. Thank you very much.